7 News, on your side at noon.
A new program prescribing produce to D.C. residents is bringing fresh fruits and vegetables into food insecure homes looking for those healthy options. The program is called Produce RX, and it's the brainchild of locally based nonprofit D.C. Greens. The program's manager, Luisa Furstenberg-Beckman, is here today to talk about it. Luisa, so good to see you.
Thank you for having me.
We talk a lot about, in D.C. in particular, the so-called food deserts and these places that really have a hard time getting fresh fruits and vegetables. And I know Produce RX actually allows medical professionals to prescribe produce. Tell us how this works.
Yeah, so providers in DC are able to write prescriptions for fresh fruits and vegetables to their patients experiencing diet-related chronic illnesses, so diabetes, prediabetes, hypertension, and their patients are able to go, they get $80 to $120 a month, depending on household size. They go and they get this debit card. It's called Fresh Connect. It's very cute. It's delivered to them, and they get $80 to $120 a month. They're able to shop at any DC, Maryland, and Virginia Giant, Safeway, or Walmart. They go to the store, they shop for anything. When they get to the checkout, they scan their card, and any fresh produce is deducted. They have a full year to be in the program, and then at the 6-month mark, they check in with the provider as a way to allow their provider to really support them in achieving their health goals.
And so these are, do they need to be doctors in particular, or can this come from, say, an urgent care, or where can they get these prescriptions?
Yeah, so they do have to get it at their clinic, but it doesn't have to be an MD or a doctor, allowing it to be more accessible. It can be a dietitian, it can be a diabetes prevention care coordinator, so trying to make it as accessible as possible.
Okay, so how's it working, for one, and who do you find is using this the most?
Yeah, so currently we have over 1,200 DC residents and their families enrolled in our produce prescription programs. They live all over the city in all 8 wards, and we have a lot of outcomes that are really positive that people have said. People are eating more fruits and vegetables. They have a flexibility of shopping that they haven't had before. People are saying that they're able to lower their medication, their doses, take less medication, and that in of itself is really fabulous.
Yeah, I mean, I guess you're tracking these people, right, to see if in fact this makes a difference, and it seems like it's all ultimately about prevention.
Exactly.
And using food as medicine as opposed to doctors prescribing actual, medication down the road. Is that how people are taking this and using it in that way?
Exactly. So this is a food as medicine intervention, the idea that we can use food to prevent, manage, and treat these diet-related chronic illnesses. There are a different variety of food as medicine interventions. So there's medically tailored meals and groceries, there's produce prescriptions like our program. The idea really that food is directly tied to our health. And that we can use that instead of medications to really support our health goals.
And what's the response typically? I mean, when people hear about this, or say a doctor says, I'm going to prescribe you fruits and vegetables, how do they react?
People are excited. We have a lot of our participants that say, I go to the doctor, I have high blood pressure, I'm prescribed medication, I don't want to take it, I won't. But if I'm able to shop for the fresh food that I both want and need to support my health goals, I want that. I want to take it. And we all know food is expensive for all of us. Inflation is really high. A lot of public benefits have been decreasing. So there's no shortage of need in the city for this program.
And so for people who may be watching this today and are interested, how do they find out more?
Yeah. So unfortunately, we've had to pause enrollment in our program due to lack of funding. This is kind of a common nonprofit thing. We spend a lot of time working to find funding that we can piece together to run programs like these. But it's not a sustainable model, and we also can't do it alone. We really need DC government. So something exciting that is happening is in the next year, there's something called an 1115 Medicaid waiver. Essentially, you would be able to have this program be a part of the healthcare system, to be a service that is covered. Okay. But we need DC policymakers to back this and support it. Food is health, and food is medicine, and food is a human right, and to be able to have this be embedded into the healthcare system is really our long-term goal.
And so right now, you're not in a position to take on any new people, but do you expect that to change?
That is our goal. Yeah, we're hoping to do it. We are able to, we have the capability to do this. We just need the funding.
And you said you are currently helping, was it 1,200 families?
Yeah, over 1,200
in DC.
families.
All right. Well, Lisa Furstenberg-Beckman, thank you so much for telling us all about DC Greens, and hopefully the funding will come soon and you can enroll even more than those 1,200 that you have now.
Thank you for having me.
Yeah, thank you very much. Have a great day.